So this is our second episode of our webinar series, Understanding the Healthcare Innovation Landscape in Indonesia, the Key to Access. I'm Reina. I'm a head and neck and general surgeon in Singapore General Hospital and National Cancer Centre Singapore and co-founder of Aardvark Labs and The Catalyst. And I'll be your host for today. So in our very first session last week, we had Indonesian Ambassador to Singapore, His Excellency Pak Ngurah Swajaya, who unveiled the future plans for the healthcare innovation landscape for Indonesia, which was followed by a conversation with Lavana Sani, CEO of Nala Genetics, and Joshua Augusta from Mandiri Capital. The recording of the video is now available on our website. So in today's episode, our invited speakers will discuss the key to market access into Indonesia's tech market and the opportunities and challenges in each sector. So we are honored here today to start by having Pak Iksan Adli, who heads Indonesia's Investment Promotion Board, BKPM, to join us today. He analyzes Indonesia's investments in the healthcare sector and cover key factors an enterprise founder has to consider before establishing their businesses in Indonesia. Daniel Chu, CEO of TMCG, will moderate the Q&A sessions for all our speakers. To the audience, if you have any questions, please post them in the Q&A panel. May I now invite Pak Iksan to come online with us, please. Thank you.
Hi there, everyone. Good afternoon, distinguished panelists, moderators. Reina, thank you for the introductions. My name is Iksan. I'm the Chief Sections for the Investment Promotions in Indonesia Investment Coordinating Board. So we call it, my institution is BKPM. So for as quick, BKPM is like IE and EDB combined, but we are directly under the president. So thank you also for everyone for joining with us this afternoon. I'm very thankful and happy to be able to be invited in these wonderful opportunities to contribute more on bringing more information to light in healthcare landscape in Indonesia. So next slide, please. Okay, so BKPM is the primary interface between the government and business entity in Indonesia. So whatever the foreign companies wants to do business in Indonesia, the first door is our institution, our office. So under the administration led by the President Jokowi, which giving the instructions last year that BKPM has been appointed as the central licensing for every ministry. So right now, we are managing around 18 ministries under our BKPM. Next slide, please. I think as we all know, currently we are facing a very challenging times. We have the ongoing outbreak across nations. And then by that situations, all business sectors such as trade, tourism, transportation, manufacturing and industries are hit and facing major disruptions. And here in Indonesia, we have also our people who are right now having more of their priority reset to get a better, well aware and concerns on the health and particularly high quality healthcare. Next, please. Well, just as a brief, everyone having a slowdown, including Indonesia. Next. Even the World Bank predicts Indonesia GDP will reach 3.5 to 2.1%. And even though our prediction is at 2.3%, within this, Indonesia governments realized that we need a specific strategy to maintain our economic growth, and one of them through the foreign direct investments. Okay, next. So as a brief on the first quarters, this is the phase of investments in Indonesia right now. As we speak, this is the official informations that we disseminate every 3 months. So within the first quarter, we have around 210 trillion rupiah being realized in Indonesia in a foreign direct investment scheme, which means they are directly opening a factory, opening an office, not investing through the stock market. So this is a direct investment in which 53% contributed from the domestic direct investments, and the rest from foreign direct investment. In here, one of the main challenge facing by every government, it's not only the slowing down of the economic, but also the risings of the unemployment. For the first quarter, we have managed to be able to open and absorb around more than 300,000 workers. Next, please. So this is the snapshots. Singapore is the biggest contributors for foreign direct investment in Indonesia. It's becoming the biggest contributor for 5 years in a row, followed by China, Hong Kong, and Japan. Now we are going to pinpoint to the healthcare. So as together we might see, for the past 5 years, the investment value that has been realized in Indonesia on healthcare services has reached more than 380 million US dollars. And the trend is always rising, particularly on the first quarter of this year, whereas it's aligned with the pandemic situations that grew and growth in Indonesia. So we have more than 570 companies already invested in healthcare service industry for the period of 5 years. This is interesting, 87% who captured these potentials is from Indonesian company. We call it DDI, domestic direct investments. And only 13% is coming from foreign companies. So in here we see actually the opportunity is wide open, very wide open on healthcare. Since right now, the one who captured the lucrative markets of Indonesia is Indonesian company. What makes the difference between the local company and the foreign company? We will need to see it from the percentage of ownerships. For easy, it's like this. Let's say I own a company, and then my good friend Rena here, or Rena is Indonesian, so probably Gabriel or Daniel coming and buy over 0.1% of my company shares directly. Then at the same time, automatically I'm becoming the Another things that makes the difference is all foreign direct investments in Indonesia is considered as a big company. Whether the size in the origin countries is a SME startups, when they doing the business in Indonesia, we identify them as a big companies. What makes the difference? The big companies is we have the minimum value above 10 billion rupiah, or it's around 700,000 US dollars, 700K US dollars. Then these were designed to be able to cater the transfers of technology, transfer of knowledge, and this could be able to giving a significant impact of adding value in Indonesia. Next, please. As I mentioned previously, the president has instructed us to become the centers of licensings, which means we process all the healthcare licensings right now. We developed it under one online system. We call it OSS, Online Single Submissions. So right now, hospital business license and clinics are processed in BKPM, even though their authority coming from the Ministry of Health. But since our spirit is to shorten the bureaucracies, making everything transparent on licensings, even until make sure that the investors, when they are investing in Indonesia or doing business in Indonesia, they develop the business in Indonesia, they're not circling around from one place to another, so they can become a planologist by jumping to another buildings in Jakarta, and I haven't discussed about the traffic yet. So everything is based in BKPM right now. So, and actually the system is designed even all of the companies does not need to come to BKPM. They just log in through their computers, log in into our systems. It's like we are copying from several successful systems, like Google. When you are opening a Gmail, same, we will give you username and passwords. And then let's say we are also copying from Amazon and eBay. Let's say I'm buying the book from one of my favorite bookstores in Yongsiak is a Woods in the Book. There's a bookstore, the Woods in the Books. So let's say I'm buying the book, and then I send it to Jakarta. I can track through eBay in let's say already in a port or in the post office. Same with your license. When you apply, we will give you the tracking numbers in which table right now is being processed, who's in charge, and the estimated time finished. And everything will be on schedules. All right, right now we have discussed on the bird eye view, the snapshots, how things are going in Indonesia right now, how to develop the business in healthcare in Indonesia. So there are two main screenings. The first is the Indonesia Industry and Business, a set of documents which will pinpoint in which business category you will fall based on your business activity. So in here we have around 8 business category that is pinpoint for the healthcare sectors. And from the screenings, when we got these business classification numbers for your companies based on your business activity that will be developed in Indonesia, then we cross-check to our negative investment list. Right now, we are doing a revise every 2 years. We make it more open. So what is a negative list of investment? Is a list of business activity that are closed or open with a requirement for the foreign investments. So right now we having the revisions every 2 years to make it more open. More business fields is open every 2 years, is being revised together with the government, the parliaments, and also the business communities. So right now we see in here most of the healthcare sector that can be developed the business in Indonesia is foreign investments can be a majority. Let's say for instance for the hospitals, it can be 67%, but if you come from ASEAN regions, you can have 70%. And also for clinics, same thing as you might see in my presentation. And then this is also the things that I want to highlight is, does a doctor can do their job in Indonesia? The answer is it's possible as long as you are working under a hospitals as the one who giving the treatments or the one who do the trainings. I think this one can be discussed later. Okay, next. I think if I'm not mistaken, the next please. The next is, this is how to open a company in Indonesia. I will facilitate these informations later in the Q&A. So this is for your information. It might looks quite complicated, but actually it's a straightforward. And everything in here from point 1 and point 2, it's being done by the public notary. So actually you don't do anything. Point 3, you do by yourself under the systems that I have mentioned before. So probably that's the brief of the informations that I can deliver. If there are any questions, please feel free. Thank you.
Sorry for the technical glitch. Thank you, Pak Ihsan, for sharing with us the landscape in Indonesia for healthcare companies who want to enter into Indonesia. We have a question from the participants, and they'd like to know 2 questions, if you can help us with it. Which area the majority of investments for healthcare are from? Is it hospital or clinics? That's the first question. The second question, how is business classification for health tech and digital healthcare or telehealth companies? And
All right.
majority foreign
Okay.
ownership allowed for companies?
Okay, so for interesting questions from Mark, thank you for the warm message. So the majority of investment right now in Indonesia, mostly on clinics, international clinics. So if you might see, as I mentioned, the previously last year, not so much international clinics has been optimally utilized from their sales and marketing perspective. But since first quarter of the 2020, the pandemic started, everyone starts really aware on the importance of quality healthcare. And then we have a travel ban everywhere, in which probably everyone knows that are traveling to Singapore for the healthcare. Since they cannot do that, so they are seeking an international based clinics or a clinics that uphold the standard of healthcare in Singapore. So Mark, I can answer right now. It's the clinics, and for clinics, for international clinics, it's a specialized clinics. If I may emphasize, is 67% can be owned by the maximum by the foreign ownerships. And then from Scott, business classification for health tech, digital health, telehealth companies. Okay, it can be under a IT companies. It can be fall under an IT companies, as long as like HelloDoc. HelloDoc, we are giving them the license. They are not fall under a healthcare. HelloDoc is under a software development. So Scott, it will be fall if you only do the bridging between, or you preparing the infrastructures for the doctors and the patients. You stand in the middle, then you are a IT or software developers. What about healthcare tech companies opportunities? Abundance. I'm telling you, abundance. Since the pandemic started, since the pandemic kicks in, we have so many new healthcare tech companies. As I mentioned, on 2019, nearly no one used HelloDoc. Right now, crazy. Okay, Alex, go. Hi, Pak Iksan. Thank you for the medical device companies. Okay, medical device companies, it depends whether you are doing the production in Indonesia or you just supplying the medical device companies. If you are doing the productions of these medical device in Indonesia, then you are classified under the industry and manufacturing companies. It's open maximum until 100%, which means you can wholly own your companies. For the trading companies, you will fall into a main distributors. Main distributors is maximum 67% can be owned by a foreign companies. Okay, we have another questions from Harsha. Okay.
Pak Iksan.
Okay.
We are running out of time, so sorry. We will need to move on to our next speaker. So maybe
Okay.
those who have got more questions, we will answer, put the answers on Catalyst website. So look out for it. Over to you, Rina.
Okay, thank you very much, Pak Isan. That was really useful. Okay, so moving on, we have our second speaker, Robin Sutikno, who is the founder of PT Global Urban Essential, on how the technology can enable the integration of data into the digital platform to better manage healthcare for Indonesians. She'll also be sharing how she successfully brought her startup to life in Indonesia's health tech scene. Let's welcome Robin to come online with us. Thanks, Robin. Thanks,
Thank
Pak.
you, Rina.
Yep.
Thank you, Rina, and the team at Catalyst for this great opportunity, and also for Pak Isan for your presentation previously. So today I will share about how our journey, PT GWI's journey, about enabling collaborative health management in Indonesia. So quickly about like the challenges in the Indonesian healthcare landscape. So as Pak Iksan said, there's a lot of challenges, but also you can see it as a lot of opportunities. And what are these challenges? The first one is that The healthcare landscape is very large and fragmented with different paces of innovation. So even if you cut across, let's say, medical doctors, within the medical doctor group, there's different associations, different specialists, and they have different appetite for innovation. Then there's also what we call reactive care, where a lot of the times in Indonesia, it's how we deal with challenges is very reactive and not necessarily planned ahead, and also very focused on the curative side of healthcare management. Whereas in the future, of course, there's a lot of space for preventive and also promotive care. Third is data availability and literacy, especially from a healthcare provider perspective. It's very challenging to decide which approach to use, or also how to better manage your patients, especially when it's large numbers, because of the data availability. And also from the patient side, data literacy can be quite challenging, especially when it comes to like data privacy and also what the ownership of the data itself. Then fourth, there's a lot of uncharted waters that of course can be seen as opportunities again. And then lastly, healthcare demands passion and long-term investment. So this is where perhaps a lot of healthcare startups or digital health startups differ from e-commerce or let's say influencers, because in healthcare, it's a very specific industry that requires a lot of regulation, and it's between life or death. So it takes a lot of passion and long-term investment personally as a startup founder, but also as a team and as a company to really build your startup and your endeavor in the long run. So I'll share more about PT GUE itself, just to give you a perspective on example or a case study of a healthcare startup in Indonesia. So this is the healthcare landscape. Very simply, there's a patient, then the patient goes to the doctor, gets a prescription. The prescription is then brought to a pharmacy usually for the patient to get the drugs. So what we have built at PT GUE is connectivity. So the first one, from the patient side, we have Teman Bumil, which is currently the largest pregnancy and parenting app in Indonesia with over 1.2 million users. So these are all mothers who are either going through the pregnancy program and then they use it throughout their pregnancy, so 0 to 9 months. And then afterwards, they will use it up to when the child is 3 years old. Then we also have Teman Diabetes. Teman Diabetes is our R&D project where we are currently working together with the PEDI, or Educator Association for Diabetes in Indonesia. And then lastly, we also have kuesehat.com, which is a platform for millennials to learn how to better live a healthier lifestyle. Then all of these patient groups on the right-hand side is connected to doctors on D2D, or doctor to doctor. The D2D is a app specifically made for doctors that we have made to help them with their CME, with webinars, but also to better connect with patients digitally. Then any prescription that comes out of consultation will then be brought to the pharmacy. And here we have goapothek.com, which is our online pharmacy. And of course, I'll share more about these platforms in the next slides. So basically in this slide though, what we want to highlight is how throughout our journey at PT GUE, we actually had to, at the beginning, we wanted to focus on, let's say, one specific user group. But then we saw that to really create value, we needed to bring different parts of the healthcare landscape online. So it's not just enough to bring on the patients, but also to bring on the doctors and also pharmacies online. So the first one is the doctor app. Currently, we have about 37,000 doctors in Indonesia who are using this app, and we have been accredited by ED. So this app itself serves to bring doctors digitally, to give them convenience by helping them renew their license, easily collect professional points, connect with one another, go through webinars as well. And this is especially important during COVID because there's a lot of education, a lot of upgrading of knowledge during COVID that has to be done remotely, because of physical distancing. And that's why in the past 3 months, we've had on a daily basis at least 2 webinars, and this has definitely helped doctors both upgrade their knowledge but also renew their licenses by collecting those points. Through the app itself, the doctors can also manage their patients better by doing online consultation. And second, they can manage their patient caseload by saving everything, all the data within the app itself, and then giving patient advice accordingly through the app. So it gives the doctor just one single app that they can use to do all these different functions. And the Doctor app connects to about 1.3 million users across these 3 different platforms. So the patients, again, we have mothers and we have diabetics, and we also have millennials. And how does Teman Bumil and Teman Diabetes? They are similar in the sense that we provide the users education. We position ourselves as a friend. So Teman means friend in Indonesian. We help them throughout their journey. So for mothers, it's before pre-pregnancy up to when the child is 3 years old. We help them every single week. We send customized and personalized information. What's the size of the baby currently, the fetus currently, what has to be done, what supplements need to be taken, even up to questions that they can bring to the doctors when they do the doctor consultation. On Teman Diabetes, we connect with a wearable blood glucometer that provides accurate information with regards to the patient's blood sugar level. And this can then be shared to the doctors, again, at D2D, where the doctors, not only in the past, they had to rely on data that was maybe two weeks old or 1 month old, because they would only meet these patients once or twice a month. But now with Teman Diabetes, the patient can easily update their information, keep track of all of their vitals, all of the food that they have consumed, the exercise that they have done. And this also can be relayed to the doctors, and the doctors can access that information whenever, providing much more quicker care for these diabetics. And then lastly, for Gue Sehat, we also work with doctors and healthcare professionals to enable them to better educate the wider audience through our social media accounts such as Instagram and also YouTube. And lastly, what we also have is we have 1,400 pharmacies across Indonesia. We have brought them online. But unlike most of the competitors, our positioning is quite different because we are an aggregator. So we place ourselves in between the pharmacies and also all these different platforms. So for instance, we work with Tokopedia and with Shopee. We also work with different health tech platforms where now, all these platforms don't need to acquire 1,400 pharmacies and also teach them, onboard them, grow them, and so on. That's the value that we bring, is Go Apotek goes out to find the right pharmacies who are really serious about grabbing the online or the digital opportunity, teaching them how to sell online, how to manage their customers, and also connecting them to all these different platforms, giving us scale to bring back to the pharmacies. So this is basically our experience in the past 5 years, where we see that in Indonesia, there are so much opportunity. There's a lot of different use cases that needs to be tackled to really, solve the pain points of different patient segments, different healthcare professional segments. And this is the journey that we have come so far. And maybe we can talk more in the Q&A. Thank you.
Thank you, Robin, for that wonderful presentation and sharing with us. We've got a question from the participant, and that's, what's your view on chronic management through telehealth in the Indonesian market?
So this chronic disease is a huge challenge in Indonesia. I mean, it's the same universally, right? But in Indonesia, it's especially challenging because it's highly fragmented. The users are spread, nationwide. And in terms of education itself, it takes a lot of time and effort and investment from the healthcare professionals to really, handle these cases. And the number of healthcare professionals who are really invested in educating and making sure that there are behavioral changes are quite limited. So for instance, with Teman Diabetes, what we've done is we not only provide them with the platform, but we are currently working on different research projects to create a much more collaborative approach to managing diabetes. And even, managing diabetes itself, it's like one topic, but it can be broken down to different pieces. And so far, so we launched Taman Diabetes about almost 2 years ago. And we are still on the journey of from little things, right? So from reminding the patients to consult with the doctors, to check their blood glucose level, and then third is to take their medication. So even those 3 things are currently top of mind for us. And we are working with the association, the Diabetes Educator Association in Indonesia, to create different models, both digitally, but also in the offline, so O2O models, to improve health outcomes in diabetes, for instance. But there are other therapeutic areas that are not being addressed yet, so like hypertension or for oncology. So these are, again, opportunities for different entrepreneurs or different companies as well.
Well, I'm sure there'll be a lot of questions on how we can use technology for chronic disease management, but we're not going to go into that. Instead, we'd like to hear from you, your personal journey. How you started Gwei, as a founder of the company, and how you've managed to scale your company. It's amazing what you've done.
Thank you. So the journey itself started in 2016. And of course, from our company name, it actually reads PT Gue, which in Indonesian means my company. So it takes a lot of teamwork, of course. And our co-founders are not just like the official co-founders, but we also see that our team are our co-founders. Because again, as I mentioned, it takes a lot of passion and a lot of personal investment to really work in health tech. So in the past 5 years, we see that our journey always starts with understanding the patients or the user segment, whoever it is that we are trying to address, and then building solid MVPs for that, whilst also building relationships with potential associations or any other partners that could help us grow. And then throughout the process, of course, we've gone into data as well on how to better optimize, the data that we use and that we have, because I guess this is another challenge in Indonesia as well. So it has gone from, learning how to build understanding users, learning how to build a product, to then creating better solutions based on the data and the insight that we have. And currently we are at the point where we are integrating all of our platforms together. Because in the beginning, of course, they were like different pillars that stood by themselves. And now we are focusing more on integrating them together to create more value. So hopefully in the next 5 years, we could, our focus is always on creating positive impact on healthcare in Indonesia. So in the next 5 years, hopefully we can enable better collaboration between healthcare professionals and also between the, patient-provider relationship, improving that. And hopefully we can also work together with the government more intensely to tackle different healthcare challenges that we currently face in Indonesia.
Great. I'm sure you had many challenges, right? And could you share with us how do you overcome those challenges, especially sourcing for doctors and convincing them to come on board your platform amidst all the other competitors?
Yeah, so for doctors, I think a lot of the journey for doctors has also changed a lot in the last 5 to 7 years when it comes to digital. So in the beginning, when we started, there was a lot of ambiguity. A lot of doctors were maybe reluctant to go digital, to even do telemedicine. But we've seen recently in 2019, and also because of COVID, a lot of doctors are now much more open-minded about grabbing that digital opportunity. But for us, actually, interestingly, with D2D, we actually started this product after we built Guapotek, Taman Bumil, so we already had a name in the market. And we work with different associations and with pharma companies as well. So we've already had some, I guess, a taste of working with doctors. But of course, with D2D, it was about how do we better understand doctors and not just see them as a doctor or as a profession, but also see them as human beings, right? I think we tend to forget that these are people who also get tired, who have, relationships at home and things like that. So we have looked at that approach to better give better value through our product to these doctors. So it's about, how can you, instead of flying and then attending a symposium for a night, instead of doing that, maybe it's better, maybe you can try going to a webinar and stay at home and do it as well, you know, and get that value? How can they also better manage their caseload? So things like that. And throughout that process, of course, because of the unique selling points that we have on D2D, I think we have been able to attract different associations, medical associations, to work with us as well, and also work with medical faculties across Indonesia as well.
Could you share with us, I mean, on the point of approaching the medical associations, the government, what was your strategy and how did you approach it, and how do you successfully get them to work alongside with you?
I think there's a lot of local know-how that is required, in the sense that, you know, within any organization there's always the where the power lies. So we've been fortunate enough to be connected with these different how do you say, like the people who work in the association and people who play a very important role in the association. So that has been very helpful for us. When it comes to the medical faculties, I think it's about just connecting the dots and making sure that we are meeting their pain points and providing value in the long run, and being consistent with that. Because there's always a tendency with startups, and I think that's where the hesitation lies, is once they work with us, they want to see that we are providing them a lot of value and it's consistent. It's not just a hit and run type of relationship or type of service per se. Yeah.
Okay. One last question before we move on to our next segment. Robin, share with us how you source for talents in Indonesia.
We source for talent mostly digitally, but like through LinkedIn and different platforms. But we also work within our network itself, because for us, talent is very, very important. But also finding the right talent means, at least for us in the beginning, was actually finding talent within the technical that had the technical expertise, but also had an interest, at the very least, an interest in healthcare. And that's very rare. So what we've seen is, having a good network of team members, always making sure that we are very clear about our intent and our plans, has been very helpful for us. And currently we have 137 members in PT GUE. And of course, making sure that we are actually building, not just, acquiring these talents, but also developing them in the long run as well, is, I think, have been very beneficial for us in acquiring these talents.
Great. Well, Robin, thank you very much for sharing with us about PT GUE, your experiences, your challenges, how you overcome them. We look forward to seeing the growth of PT GUE in the next 5-10 years. Over to you, Rina.
Okay, hey, thanks, Robin. That was fantastic. Actually, it's great to hear that. I mean, being a doctor is definitely great that founders are also looking to help, not only help patients, but also to help us healthcare professionals. So last but not least, we have our final speaker of the day, Gabriel Sim. So Gabriel's the Director of Strategic Partnerships from APAC Med. So coming from the industry point of view, he will be sharing the power of a unified voice where stakeholders both in the public and private sector are actively engaged in the ecosystem to foster more innovative collaborations and achieve better healthcare outcomes. So let's welcome Gabriel online with us. Thanks, Gabriel.
Okay, thank you, Rina. I hope you can see the slides.
Yep.
Okay. So, as an introduction, APAC Med, we are a not-for-profit medical technology association. Basically, we lead the effort to advance medical technology in order to raise the standards of care for patients across Asia Pacific. I just want to show you a snapshot of some of our member companies. We are fundamentally a membership-based companies, started by the industry. So if you see from this slide, we represent, companies in the medical device, the diagnostics, as well as the digital health space. And specifically for Indonesia, we have a few Indonesian companies that are part of our ecosystem, including Trust Medis, HIS company, TeleCTG, very famous in Indonesia, and another Genetics, which was one of the speakers for last week's Catalyst webinar. And we also have GAKAS Lab, which is a local medtech association in Indonesia. And this ecosystem is important because it helps to facilitate growth within the industry. And if you can see from this chart, 60 out of our maybe 160 companies here are startups, and we want to look at how we can support these startups not just in Singapore but across the Asia Pacific region. So today I just want to address 3 areas. It's about Indonesia. Why do we want to look at Indonesia? Is it a promising market? So that's one question that we want to ask ourselves. What is the new normal for healthcare in Indonesia and also across the Asia Pacific region? And more importantly, how should the the healthcare ecosystem respond to support the industry? Okay, this is a chart that I developed a few weeks ago, and I think there are a couple of things that we can learn about in Indonesia from this slide. I think one of them is the size of the market. As you can see from here, Indonesia is the has the fourth largest population in the world. The top 3 are China, India, and US. If you look at these 4 countries, the digital economies is thriving in these 4 countries, thanks in part to the big population in this country. So that's one. And also we see that there is a very strong population boosted by the millennials. About 30% of the population are made up of the millennials, and that's those from 21 to 36 years old in the year 2020. And we also see a very young internet savvy population. So this is one takeaway from this slide, the size of the population. Number 2, the economy. So Pakistan has mentioned the economy earlier on just now, so I won't go into it. But I just want to mention two points. One is that Indonesia has impressive growth and economic resilience over the last 20 years. And Pakistan also mentioned about G20. And if you look at the G20 countries, Indonesia is among the fastest growing country in that group after India and China. The third thing that I want to draw from this slide is the startup ecosystem. So the country is prepared to invest in innovation. BKPM, where Pakistan shared, is the interface between business and the government. And because of this, it has resulted in a few unicorns in Indonesia, and we are very familiar with them, including Gojek. And potentially, we may see some unicorns coming up from the healthcare sector. The investors are also investing, heavily in the startup ecosystem. If you look at Galen's Growth report, Indonesia is the 2nd largest recipient of venture capital in Southeast Asia after Singapore. And also we look at, but one thing I want to mention about this slide, which is not reflected in the numbers here, is the startup itself. If you look at Indonesia, much of the startup activities, has risen in order to solve local problems. If you think about, fintech, how did fintech came about? It's because fintech want to address the unbanked population. And if you think of agri-tech, for example, how did it came about? It was mainly to solve problems, productivity issues, efficiency issues that the farmers are facing. And I think this is the mentality that the healthcare startups are also adopting, looking at unmet needs that are in Indonesia, the issues and challenges that are facing, and coming up with innovation to address this unmet needs. The fourth thing I want to highlight about this chart is the digital ecosystem, the digital economy. So Indonesia's internet economy is expected to triple to 133 billion by the year 2025. And if you look at the slides here, there's also a number on the revenues for digital health. And this is expected to grow from $85 million in 2017 to $1 billion in 2023. And this represents a compounded annual growth rate of about 60%. And this is what makes the country really, really effective. Okay, the next slide, healthcare in a new normal. I don't have a crystal ball, but I think this is something that, we will see, a changing, in Indonesia and also many parts of Asia, many parts of countries in the Asia Pacific region. There is definitely a strong push to go digital in healthcare. I think this is the first thing that, we will, see very evidently in the new normal. And Indonesia is actually leveraging on the benefits of, we talk about the growing internet, economy, and Indonesia is leveraging on the growing internet connectivity to address some of the challenges that they are facing in country. If we look at, the digital space within healthcare, Indonesia is moving in from paper-based, they're ditching paper-based records into electronic ones. And this has paved the way for AI to be adopted to manage big data. And at the same time, we are also seeing that physical devices are now being able to connect to the internet. And all this will come together to form a digital ecosystem. So I think this is one thing that will feature very strongly in a new normal. Secondly, convergence. And what I mean by convergence is that, we celebrate technologies like AI, sensors, wearable tech, voice tech, for example. The new COVID-19 age is all about enabling these technologies and with 5G to converge in a whole variety of new ways. And that's one. And secondly, we will also then be able to converge the silos of data into cross-functional analysis and deliver personalized care. So that's the second thing that I think we'll see in the new normal era where, the different technology converges. Secondly, implementation and integration. We've seen how health tech startups have become a very integral part of the healthcare ecosystem. If I can draw an example, Ido Health, an online startup in Indonesia, has partnered with Siloam Hospital to offer online outpatient services in the hospital. So I think increasingly we'll see an integration of the health tech solutions being deployed in the healthcare system. But one thing I want to mention is that it's really about implementation and integration. But of course, we need to ensure that when we do this, we have the needs of the patient in mind. And it's important for integration, for the key reasons is that if we want to maximize the impact, we need to involve the startups and integrate their solutions into the healthcare system. Last but not least, new care models. And I think we've read a lot about new care models and how this will move in a new era. I can think of the finance sector and the retail sectors. Over the last few years, they've really moved on to an omni-channel channel, an online-offline channel. And I see this happening in the hospital as well. And actually, there are two care models that is very close to my heart. One is virtual care, and I think telehealth, telemedicine will take a new a new spotlight in the new era. Another model that I think we will see increasingly is a hospital at home concept, and this is how can we deliver acute care in a home environment. And in the Asia Pacific region, I think only Australia and possibly New Zealand have deployed this model. But I think going forward, this would be a model that we would see coming forward. So the fundamental of this slide is that digital health in a new normal can help us to expand our access to lower cost and improve clinical quality. So my last slide. So how then should the ecosystem respond to a startup? And this is again very close to my heart, and this is why I'm part of APAC Med, where we are trying to build an ecosystem to support the industry and to support the startup. Okay, the first one is the top right. You see a very big handshake and a small handshake. And this is where I'm making reference to the big multinational companies. And I think this is where, we need the large, healthcare companies to be willing to take some risk to support startups, whether in terms of partnership, whether in terms of licensing deals, or whether in terms of seed investments. Yeah, so there are a few companies that I'd like to mention, and they are very, very actively involved in innovation and involved in working with startups. J&J is one company. that has different programs that caters to different stages of the startups, from the early stage, to the mature stage. And recently, in a Asia Pacific region, they have launched J Labs, which is the life sciences incubators to support startups in the ecosystem. Philips is another one that has a corporate venture arm that is also actively looking at supporting startups and collaborating with startups. Even pharma companies like Pfizer has a digital innovation lab, and they're constantly exploring opportunities to engage and work with startups. Another segment of the market is the insurers, and in Indonesia, I think this is very well featured. If we look at some of the global insurers like Prudential and AXA, they have been working very, very closely with some of the Indonesian startups like Halodoc and Halo Doctor, for example. And I think this is something that we would want to encourage the global companies to continue, because I think I did a survey among some of our APEC-led startup members 2 months back. And out of the survey, 90% of the startups, came back and said that they are actually looking for partnership with global companies. And that's a huge 90% from maybe about 80 respondents. So I think the corporate plays a very important part in supporting the ecosystem. Number two, investors. No matter how innovative an entrepreneur is, it's unlikely they will be successful in commercializing the product without money. And I think this is where the investors come into play. And I think investors are very, Indonesia is a very promising market for investors for a few reasons. And this, I'm making reference to my first slide, the readiness to adopt, digital technologies, the improving connectivity, and the rising internet, penetration. And these are the things that, will encourage investors to want to look at some of the health tech startups that are coming up from Indonesia. The third item here is government. I think Pakistan shared a very, very important, information earlier on. And this is where, we need the government agencies, to help accelerate the growth of the digital economy and to encourage more investors to invest in the health tech sector. But I think that there are a lot of things that we can do within this space, supported by the government, including the Ministry of Health. And one of them is a regulatory sandbox, and this is something that Singapore has deployed. In Indonesia, the government has also deployed a regulatory sandbox for fintech. Yeah, but I think with health tech getting prominence, and with regulations easing slightly for telehealth, we don't know how the future would be, and probably a regulatory sandbox of this nature could help startups to try out new solution and to innovate. And in Indonesia, for example, Indonesia has come up with various initiative and program like the Next Indonesia Unicorn. And because of such programs, Indonesia is able to have 5 or 6 unicorns right now, and we'll see more coming from Indonesia in the next few years, I believe. Another initiative that I want to highlight that is a government initiative is the Global Innovation Alliance with Jakarta. So this is a program that consists of 10 countries across 13 cities, including Singapore, Jakarta, for example. And this initiative has been developed to facilitate, collaborations among startups, to support startups among the member companies that are part of this alliance. So I think the government plays a very important role in supporting the startups. Next is provider. I think providers are also very important in supporting the ecosystem. And I say this with reference to what Singapore is doing. So in Alexandra Hospital, for example, AH has opened 2 future-ready wards to deploy pilots with the aim of to understand what's best, for the patient, the family, and the staff. And having a test bed, a live test bed to test solution, I think is quite critical. Another initiative that's coming out from one of the hospitals in Singapore, the National University Hospital, is that they're piloting a hospital at home program. Again, this is something which I mentioned earlier on, which could potentially be a future model of care. And again, the program is to look at how we can, change our care model, our delivery model, to ensure that it benefits patients, but at the same time leveraging on innovative technologies, to support this care model. Yeah, so I think this is all I have to share with all of you, and I just want to conclude that the ecosystem is really essential, and it's important for all of us to come together, to support the startups, to support innovation, so that they have a chance for survival and a chance for growth, and to benefit the patients ultimately.
Sure. Wow, Gabriel, thank you so much for sharing us. I think that was a lot for us to digest. There are a lot of questions, but unfortunately, because of time, I'm going to focus on just one question, and that is, what is your advice for startups who want to collaborate and or partner with large pharmaceutical companies?
Okay, I think first of all, I just want to say that I think the corporates, they are constantly looking for innovation. So whether there's a pandemic or not, they are constantly on the lookout for innovation. But I want to turn this around, to help startups to see where the corporates are looking at. So when a corporate wants to partner a startups, they typically ask three questions. The corporates will ask themselves, why this space? So this is the first question, startups would have to, convince the corporate. Number two, why would the startups want to work with you? Again, this is something the startups would have to convince the corporate. And the third question the corporate will ask themselves is how they as a corporate entity can add value to what the startups is already doing. I think if the startups can address these three questions, the corporate will be very willing to engage in a discussion with you.
Great. Gabriel, thank you very much for spending your time with us. We're going to hand this session back to Rina.
Hey, thanks, Gabriel. Looks like we definitely allocated not enough time for this. We'll follow it up next week. So thank you all again for joining us. We'll be sharing the video once it's up and ready in our website, and that's on thecatalyst.sg. That's TheCatalyst.sg. So as mentioned again, please join us for our final session next week, where we will have three startups, and the topic will be startups perspective, their challenges, and it's happening Tuesday, 23rd of June at the same time, 4 p.m. Singapore time. We'll be having two startup founders and Mark Wang, who's from Pureland Ventures, with us. And once again, thank you very much, and I'll see you guys all next week. Thank you.